Hey y'all, I'm Dr. Jimmy Red, owner of Red Family Insurance in Starkville, Mississippi. I've been selling health insurance for 13 years, sold thousands of policies. I want to educate you about health insurance today to make it a little easier to understand. One of the most important supplemental policies I recommend adding to your major medical coverage, outside of course, dental and vision, is a critical illness policy. Now, what is a critical illness policy? It's a policy that is designed to cover certain critical illnesses, for instance, cancer, heart attack, stroke. Those types of illnesses are very, very costly, and they might bankrupt somebody even if they have major medical health insurance. So they're usually pretty affordable, and especially for somebody who's young, and I think they provide a lot of great value and security and reduce various risks that you might have, and a lot of my clients have had through the years. So, cancer, heart, and stroke plans are the most common critical illness plans. They're AKA sometimes called CHAS. Now, there are different types of cancer, heart, and stroke policies based on what carrier you get them from. My favorite type is called a lump sum critical illness plan. And the reason why I love those so much is because they're so easy to understand, they're so easy to use, and you can use the money for whatever you want to do with it. You file one claim when you're diagnosed with cancer, and you get a check, a one-time check, and you do whatever you want to with it. And that's why it's called a lump sum. So typically these plans, you can choose the lump sum between $5,000 and $75,000. I've seen it up to $100,000. So let's imagine you chose, I've got a cancer, heart, and stroke plan that's worth $50,000. If I get diagnosed with internal cancer, I'm going to get a check for $50,000. I'm going to cash it and I'm going to do whatever I want to with it. Now, obviously, what am I going to probably do with that money? I'm going to use it to pay for my medical costs, right? So my medical plan has a $5,000 deductible, and I have to pay 20% after that until I reach my maximum out of pocket of $10,000. So I want at least $10,000 in lump sum cancer coverage right there to match my maximum out of pocket. But this is what I've seen through the years. Somebody gets diagnosed with cancer in November, they're going to reach their maximum out of pocket in 1 year, and then when January hits, they're going to reach that maximum out of pocket again as they're getting chemotherapy and using very expensive cancer drugs. So you want to at least double your maximum out of pocket. So $20,000, right? Not exactly. I would have even more. What's the most important reason that I've seen to have cancer, heart, and stroke coverage is the non-medical costs. The non-medical costs right there. So I have a very good friend. I saw what happened to him last year. He had a massive stroke all of a sudden. He is 55 years old. He was the main breadwinner for his household. When he had a massive stroke, he could no longer work. Now, he had COBRA coverage for 18 months after that, but that eventually ran out, and he lost all of this income that he was bringing in for his family. That additional $30,000 that I mentioned, bringing the total up to $50,000, gives him a security blanket to help him with the non-medical costs related to losing his employment. And also, a lot of people who get cancer, they end up traveling to places out of state. I'm in Mississippi, so where will people go? They'll go to Alabama, they'll go to Memphis, or sometimes they'll go to Houston and to some of those big hospitals there in order to get leukemia coverage or something like that. That is costly not only because of the travel, the hotel rooms and things such as that, but also because a lot of times their spouse will have to take off work and go with them to those places as well. And so that extra lump sum money provides additional security. Now, when should you buy a lump sum cancer plan? You should buy them when you're young, especially if you have a history of cancer in your family, especially if you're a tobacco user. Now, that's because they have age-based premiums. Because I bought mine when I was 20, my plan for $50,000 is only like $20 a month in coverage. $20 a month in premium, $50,000 in lump sum coverage. Some of these plans don't rate whether you use tobacco or not. You get the same coverage. So choose your provider based on that, your carrier based on that. Now, also, these plans are underwritten. Too often I have clients come to me and ask for these plans, and they've already been diagnosed with cancer, or they suspect that they might have cancer. They've had some abnormal results. That is not the time to apply because you usually can't get the coverage. Now, it's not to say that if you've had cancer that you can't get it. I recently sold someone, a breast cancer survivor, who'd been clean for 5 years, all good results for 5 years. I sold her a plan. She had been through coverage and she was able to get it. Now, the final thing I want to say is why a lump sum cancer plan versus your typical, I'm not going to say the carrier's name, but whatever coverage you might have gotten through your employer or that you might have purchased 30 years ago. If you bought a cancer plan 30 years ago, you really need to look at your plan again. You need to evaluate it. Can you imagine how much cancer cost 30 years ago versus now? You really need to think about that right there. Your plan probably isn't covering your needs anymore. An employer plan, oftentimes, they'll have a very small lump sum benefit, and then it'll have a benefit that'll pay, $50 for a lab x-ray. It'll pay $1,000 for a chemotherapy treatment. It'll pay $100 for a hospitalization. Imagine if you had cancer. Would you want to file a claim every time that you have one of these things? Because typically the hospital's not going to file those claims for you on those supplemental things. You're going to want to file 30, 40 claims? No. That's why I love these lump sum cancer plans. You file one claim, you get one big check, and you do with it whatever you want. If you have any questions about cancer, heart, and stroke plans, drop a comment below. I'm Jimmy Red, Red Family Insurance, Starkville, Mississippi. Thanks for listening.